I've been at the Mental Health Association here for 13 years.
Great.
And this is a consumer-driven run organization, so that most of our employees, around 75%, are persons who have a mental illness, have been diagnosed with a mental illness.
The camera were the board of directors of UPMC, and you could look them in the eye and talk to them. What would you tell them? What would you tell them?
To please reconsider your stance, and please don't hide behind this idea of choice. This is not adding choice, this is diminishing choice. The people who receive whatever type of insurance that they have should have full access to all the services in this community. We are with Highmark currently, and we're very concerned that with the folks that we have, they often have more than just a mental health issue. There's often a lot of other kinds of issues that go with that because of the nature of medications and the side effects. And they see various providers, doctors in the community. Some may be associated with one hospital or one program and some with another. To ask them at this point to have to make major changes in who their providers are going to be for those services, or have the choice of paying out-of-network kinds of fees, is really prohibitive to them. You know, this is a social service agency. We can't pay big dollars to folks. And they can't afford the out-of-networks. They are going to be forced out of seeing physicians that they've grown to rely on, and they may have 3 or 4 that they're dealing with at any one time, including a psychiatrist. To have to disrupt all that is truly threatening to their ability to maintain their recovery, to feel that the network of support that they've often spent years building is now going to collapse. To have to face that, I think, is really going to be very difficult for our employees, and patently unfair. They will not be able to use those out-of-network services. They are going to have their choice diminished.